8:30 Kuala Lumpur time. Good evening, good morning, good afternoon, everyone. Big hello from all of us here in Kuala Lumpur. Thank you so much for joining us. My name is Rajat Khosla, and I'm delighted to welcome you today for our event with the Sexual and Reproductive Health Matters Journal for the International Women's Day. Before I start, colleagues, I wanted to inform you that we will be recording this session in case you have any objections towards it. May I please request you to switch off your cameras, also to let you know the event is being live streamed through YouTube and other channels. Colleagues, dear friends, it may sound like a cliche if I begin today by saying we stand together at a crossroads. Digital technologies can have a transformational impact in the lives of women and girls. Artificial intelligence has great potential to help women and girls take better controls of their health, bridging gaps in access to health-related information and education by providing timely, accurate, personalized answers to a variety of health questions. This could very well be a game changer, especially in settings where certain health issues, such as those related to sexual and reproductive health and rights, are still considered a taboo. But it is also now widely recognized that digitization in low and middle income countries in particular is making existing inequalities in healthcare access even worse. And there is a grave concern that the internet has become a vector for abusers targeting women and girls, including with misinformation, disinformation about sexual and reproductive health and rights. With the artificial intelligence industry estimated to be worth hundreds of billions of dollars and data commonly being referred to as the new oil, there is also widespread unease about big tech companies' monopolization of our personal data. And what does this mean for bodily autonomy? As restrictions and attacks on women and girls' bodily autonomy intensify in many parts of the world, the datafication of our lives is also accelerating, something that the panelists will be thinking and reflecting together in a moment's time. Our bodies no longer exist just in the physical world. They also exist in the digital domain. For example, in the data about how many steps we took today, about locations we visited, the routes we traveled, the information we searched for, the food we ordered, the financial transactions we made, and the data we shared with software applications about our physical or mental health. AI can assemble these disparate pieces of data and create what is called as a digital profile of each of us, where the digital puzzle about the pieces of our bodies are put together to form a personal, sensitive, identifiable whole. Why does this matter to me, you may ask? Well, what if your physical or mental health app is sharing data about your body or your mind with your health insurer or your existing or potential employer? And what if your internet search is about abortion pills and chat communication with your family about your body and about your personal choice could be handed over to the government by Google and Facebook to build a case to prosecute you, especially in countries that actually criminalize access to such services? This is exactly what has been happening in countries like United States, where a woman and her daughter will stand trial soon in the state of Nebraska for performing an illegal abortion, with a key piece of evidence which is being provided by Meta, the parent company for Facebook. As abortion bans across the United States of America are implemented and enforced, TechCrunch reports that law enforcement is turning to social media platforms to build cases to prosecute women seeking abortions or abortion-related medication. And online platforms like Google and Facebook are helping them. And as well, hear from our panelists today, this isn't just happening in the United States, but it is a growing trend, including in low and middle income countries and in pretty much every region around the world, where the internet is being used to target both individual women and providers of safe abortion services. Given the power asymmetries between big tech companies or government data processors and individual data subjects, are existing safeguards sufficient, particularly if we are disadvantaged due to gender, poverty, lack of education, ethnicity, religion, or sexual orientation? Or is aspects like GDPR a paper-based solution to an exponentially more powerful digital challenge, and we are rapidly losing controls over our bodies in the digital space? The gender costs of business models of big tech company are based on data extraction, concentration of power, and fundamentally privacy and data protection legislation that has not been able to keep up with the digital transformation. Clearly, data governance needs to be reimagined. Colleagues, the Lancet and Financial Times Commission on Governing Health Futures argue that the governance of digital technologies in health and healthcare must be driven by public purpose, not by profit. If the potential of digital technology for enhancing sexual and reproductive health and rights is to be realized, we must ensure the widest possible public debate about alternative approaches to data governance. And given the ubiquity of technology facilitated gender-based violence and gender biases in big data sets and the algorithms that use them, we need to position women and girls' rights at the center of these debates, not as a segue or an afterthought. As I said today, on the International Women's Day, we stand together at a crossroad. how all the stakeholders speaking today and all of you who are participating in this webinar respond to these challenges will determine whether the transformative impact of digital health interventions will truly benefit the women and girls that need it the most. Colleagues, we have a star-studded panel of speakers that will start their remarks and their framing presentations in a moment's time. And may I start with you, Dr. Pascal Alotte, the Director for Sexual and Reproductive Health Department at the World Health Organization. And if you could begin by telling us how increasing restrictions and attacks on women's rights and bodily autonomy have impacted women and girls' sexual and reproductive health in low and middle income countries, and what are the World Health Organization and partners doing to mitigate this trend? Over to you, Dr. Alotte.
Okay, may I first begin by wishing everybody a very happy Women's Day. It's great to see old friends and familiar faces and to meet some new ones. Now, working in the area of sexual and reproductive health and rights can be both incredibly rewarding and intensely frustrating. As humans, we are sexual beings from birth, influenced by biological maturation through to aging, and we progress through childhood, adolescence, adulthood, and later life. And we continue to grow and evolve through our relationships with others, including family members, intimate partners, and friends. Our sexual well-being is fundamental to health and quality of life. It is deeply personal. It is about our bodies, the one thing over which we should have power, control, agency, and choice. And it is unbelievably frustrating that there is even a question that bodily autonomy is something that we need to claim, much less defend. But here we are. The very idea that we need to celebrate Women's Day is a testament to the ongoing injustice that needs to be addressed. The latest maternal mortality ratio estimates published at the end of February by our department in WHO with UN partners remind us that the toll on deaths related to related to childbirth. I'm joining you now from a global summit on postpartum hemorrhage, the leading cause of pregnancy-related deaths. Absolutely preventable, but progress is stagnated because we got complacent. And we still need to revert to statistics like every 2 minutes, a woman dies in childbirth. Every 6 minutes, that death is from excessive bleeding or postpartum hemorrhage. This means that almost a quarter way through the 21st century, while we can send people on joy rides to the moon, women continue to be limited in exercising their basic right to health. Now, our data across sexual and reproductive health and rights consistently point to deep gaps in rights and justice, gender equality, human dignity, and broader social well-being issues. So almost 30% of women have been subjected to either physical and/or sexual intimate partner violence or non-partner violence in their lifetime. We estimate that as many as 38% of female homicides globally are committed by male intimate partners. 43% of women cannot make their own decisions about their sexual relations, use of contraceptives, and healthcare. The UN is still only collecting this data for married and in-union women, so the real numbers are very much higher. Around 45% of all abortions are unsafe. Sexual and reproductive health and rights are a political choice. Around the world today, we see a lack of political will and action, insufficient funding, restrictive laws and policies, gender norms and health systems constraints, including insufficient integration of comprehensive sexual and reproductive health in national health benefit packages and in primary health care. There is also a concentration of global crises. We've got a climate crisis topped up with a pandemic, followed by economic turndown, old and new armed conflicts, and protracted emergencies within and between countries, leaving an ever-increasing number of people, especially women, with humanitarian needs, in food insecurity, and with eroding human rights. And in crisis, there is a tendency to prioritize political order above rights. Women and girls suffer when there is a lack of investment or a lack of political will towards realizing bodily autonomy and access to sexual and reproductive health services. And all of this is the landscape before I actually begin to address the active forces of backlash against women's rights. So there's been a rise of the familiar isms and phobias. Authoritarianism, ultra-conservatism, nationalism, racism, xenophobia, homophobia, transphobia, anti-feminism are creating environments hostile to sexual and reproductive health and rights and women's rights. Whilst this has been the narrative for several years, there have now been a number of systematic investigations to clearly document the social engineering of misogyny, patriarchy, and racism. And I draw your attention particularly to the report published by the European Parliamentary Forum for Sexual and Reproductive Health. I can put the link in the chat shortly. And some countries have intensified their efforts to stop social dialogue on issues such as family planning or contraception, gender-based violence, and abortion. So what are we doing to address this? Broadly, we need to celebrate progress, actually acknowledge what has been achieved. So do more and do better to elevate important progress in countries and show that despite the polarized political climate, there are important achievements, and these achievements have been beneficial to women and to our societies. We need to unmask power, show who has it or who took it and why. We need to show who does not, why, and with what are the consequences for sexual and reproductive health. We need to confront power with the evidence we have generated and channel it through human rights accountability mechanisms and through strategic alliances with governments, parliamentarians, and civil society partners. We need to seek to transform power inequalities by transforming knowledge systems and change what we consider as evidence, and to set participatory research agendas through evaluations and trying to answer the question, can power be distributed differently for a social contract more conducive to sexual and reproductive health and rights? And so in the last years at WHO, our technical work has led to changes that include the launch of the WHO Abortion Care Guidelines last year, a landmark technical document which has made a fundamental contribution to global discussion, provision and regulation of abortion as healthcare. There's a growing portfolio around self-care interventions for sexual and reproductive health and rights, including digital technologies, built on robust evidence and a people-centered approach that shows a path to improving access and coverage of sexual and reproductive health and rights options beyond facility-based care. We have research relevant to the management of complications of preterm labor, which is serving as a much-needed call to action for renewed focus on improving coverage and quality of pregnancy care and debunking the myth that effective interventions cannot be delivered in lower resource settings. We have a renewed focus on shifting harmful gender norms and power asymmetries, including with respect to societal construction of masculinity, key to achieving bodily autonomy for women, girls, trans, and gender diverse individuals, and a focus on youth-centered digital health interventions developed with partners including UNFPA, UNESCO, and UNICEF. It provides guidance on effective planning, development, and implementation of digital solutions with and for young people to address the many health challenges they may face as they grow into adulthood. And through building best evidence and recommendations based on rigorous research, clinical and community interventions, human rights norms, values, and systems analysis and change, leadership, and active listening, WHO is taking a strong stance on advancing sexual and reproductive health and rights as core to universal health coverage and fundamental to every person's health and well-being. And finally, we're launching a focused program of work on strategies to improve our message and enhance access to reliable, evidence-informed approaches to accessing the best care and best information for the choices that women make for their bodies. This involves better listening, co-production of interventions that respect the ultimate notion that women, patients, clients, the end users are their own best ambassadors. Obviously, we can always do better and should always try to do more. Thank you.
Thank you. Thank you so much for that, Dr. Alote, and also for highlighting the enormity of challenges, some of which remain part of the unfinished agenda, but also the new and the emerging issues that have been pointed out by you, but also how the complexity and the intersection of a lot of these issues are creating new and enormous challenges for women's rights in a variety of spaces. And I'm sure we will come back to some of these issues as we talk through and go through the other presentations as well. May I now come to you, Ms. Nerima Ware, Acting Director for Kellen Institute in Kenya. Nerima is not only the Acting Director for Kellen, but has got enormous experience working on sexual and reproductive health and rights issues in Kenya, and would be talking to us in terms of looking at how criminalization of abortion is impacting women and girls in Kenya and the providers of safe abortion, but also how both the opponents and advocates of safe abortion are using internet to support these efforts. Over to you, Nerima.
Thank you so much, Rajat, and I hope I'm very clear. So I'd also like to start by saying Happy International Women's Day, everyone. And it's really such an honor to be here today and to join you in this discussion. So the criminalization of abortion in Kenya is a lengthy story that's usually very difficult to tell, but very present and prominent among women's life in this country and needs to be continuously discussed. So Kenya criminalizes abortion through our penal code. Our penal code is a colonial legislation. So it came as part of the British legislation that formed our country, and it has remained part of the fabric of this nation till to date. And it's been one of the largest contestations of our time, access to safe abortions, and then what a legal abortion means in this country. And this contestation even got up until our constitutional reform process. So in 2010, Kenya got a new constitution. And in that new constitution, one of the prominent questions sought to be asked was, should women be allowed to access an abortion? And it was a debate across the country, with many saying no, others saying yes in certain circumstances. And part of the political contestations then resulted in would call it a compromise. And the compromise did a number of things. The first thing is that it stated that life begins at conception, which brings a new tension into our law. The second thing it stated is that abortion is unlawful, takes us back to the penal provisions, but put out circumstances under which abortions could be legally accessed. So if life is in danger, if health is in danger, if it is required for emergency treatment, or if it is governed by any other law. So this opens it up to the legislator at both levels of government, both county and national. We do have a devolved system of governance when it comes to health, to put in circumstances whereby abortion can be accessed by women. Such circumstances include during if sexual violence has occurred. And this was debated in our constitutional court in 2016, highlighting that in the instances of sexual violence, that rape, defilement, any sexual violence within the context of the Sexual Offences Act, a woman may access an abortion safely and as required by law. Now, why I call this a political contestation, and I think this goes back to what are the big political questions, is there is a consistent unwillingness to allow women to access safe abortion. So our state's position at this point is that women can access post-abortion care as part of free maternity care in Kenya. So the entire package of free maternity care, which is legislated in our country, which includes antenatal care, postnatal care, and natal care when you are in maternity, includes access to post-abortion care. However, women are not able to access, women and girls that is, abortion care services or comprehensive abortion care within the public health system in Kenya. Such services are not made available despite numerous challenges in court, more than one. There've been three at this point. One is ongoing, two have been concluded. Despite numerous petitions to the Ministry of Health, despite numerous discussions with various legislators, it remains politically contested that this cannot happen. So while we continue to tell women, this is your right, the reality is that right is only accessible if you have access to private healthcare services. In public healthcare, you cannot access it. So what we've done in this country is we've told women, we are happy to save you if you try to kill yourself. But prior to that, we will not intervene. And this then goes to the abortion statistics in this country. So as of 2012, and we haven't had a study looking at this again, we have 464,000 abortions in this country globally, and in this country annually. About a third of those, 464,000, are induced, and about a third of those are unsafe. So, and this affects young women more than it affects older women. The other aspect is that we've done a study in 2018. This is the Ministry of Health has done a study in 2018 indicating how much post-abortion care costs this country. And around 500 million Kenya shillings, perhaps that would be $500 million Kenya shillings is maybe $5 million, is spent annually treating post-abortion complications. And this obviously includes a number of complications, including death in some instances. So it's not going to be treating, but trying to manage the complications that come from post-abortion care. And one of these many difficult questions was actually highlighted in one of the cases before the judiciary around JMM, a young lady, at the time a girl, who was defiled at 14, ended up becoming pregnant because of the perception of blanket criminality on abortion, sought an unsafe abortion. And she was a backdrop of a case challenging the ministry's refusal to provide safe abortion services in public health care. However, despite being the backdrop of this, despite being the face of this movement, JMM suffered such severe complications that by the time there was a positive judgment stating that the Ministry of Health should provide the services, she was already dead. That's how severe the complications can get. And now to go to the second question, I've said the problem. The second question is, what does this mean for women and girls? So there is a blanket perception of criminality when it comes to access to abortion. So for women and girls who are targeted for seeking to procure an abortion, for medical providers who are targeted when seeking to provide them, and then also for anyone who provides pharmaceutical commodities. So it's termed as noxious substances, but pharmaceutical commodities towards abortion can be targeted under our penal code. And this blanket provision isn't actually looked at in the context of any constitutional regime. And there are a number of reasons for this. Not everybody understands and appreciates the Constitution in its entirety. Not everybody understands the little other pieces of law that interact with the Constitution to highlight what your right is as a woman. But most significantly, the police do not understand this, and therefore operate as if it doesn't exist. Prosecutors don't understand this and operate as if it doesn't exist. And then finally, magistrates' court, most often than not, do not look at constitutional frameworks and only focus on the penal code. So we have a number of women, providers, girls being arrested, arraigned before court, either more often than not, either acquitted or there's a nulla prosecution or the prosecution halts because it's very difficult to prove an abortion-related offense. Often it's based on stigma and discrimination from the community. And then to the last thing, how are our opponents and how are we using the media, the internet, the technological advancements? A number of ways. One of the first key things is such hotlines like Auntie Jane provide accurate information around SRHR and access to safe abortion care. Another aspect is campaigns of mis and disinformation and then counter campaigns of accurate and positive information. Another significant aspect of how the media, internet is being utilized is really around providing information for young people. This creates a lot of safe spaces for young people to interact with information on SRHR. However, it's also really cultured with a lot of mis and disinformation that pushes them away. But this significantly goes to the fact that public healthcare services are not considering SRHR, particularly of young people, and more significantly, abortion. Thank you.
Marima, no, thank you so much for laying it out in terms of the legal barriers and access to safe abortion care in Kenya, which I'm sure is a story several people in the audience would have very much associated with, but also what you very articulately put forward is the cost of inaction, which is being paid by women and girls through their lives. And also, as you were starting to describe towards the end, which I hope other panelists will be able to take it up, is both how technology is being used to provide information through the hotlines, as you mentioned, in terms of access to safe abortion services, but also how technology is being used to spread mis and disinformation as well on issues like safe abortion care, what is available, what is not available, what is safe and not, what is not safe. With that, may I turn to you next, Ms. Anya Kovac. Anya is the founding director of the Feminist Futures organization. Anya, there is clearly a risk that personal, sensitive sexual and reproductive health data can be misused to identify and target individuals. As the founder for Feminist Futures and a researcher, writer, and speaker for years on the issue of data governance, could you highlight for us how effective do you think the existing safeguards are? And if in your view, these safeguards are inadequate, what are the risks for women and girls' bodily autonomy? Something that we also see as a question from one of the participants on what can we do and where are some of these safeguards? Over to you, Anya.
Thanks so much, Rajat. And first, from me also, happy International Women's Day to everybody. It's a real pleasure to be here with you all. I think the news you mentioned at the very beginning of the session, Rajat, about Meta and Google handing over user data to law enforcement to actually prosecute women for having had an abortion is a very real indication that this problem is real, right? And that the concerns that users have about these issues are not just a figment of their imagination. It's also clear that the current safeguards are completely inadequate. But the point I want to make here is not so much going into why the gaps or what the gaps in the framework are and why it doesn't work, as really making the point that the frameworks we are currently using are really not going to allow us to fundamentally improve things. What we are focusing consistently is the protection of privacy or data. And what we really should be focusing on is the protection of bodily autonomy and integrity, of dignity and of freedom. Why is that not happening at the moment? The problem is with another thing you mentioned at the very beginning, Rajat, that at the moment we talk about data as a resource, as oil, an often used metaphor, as something that is out there, it's in everywhere, and because it's in everything, it's also ready to be mined by whoever comes first. But in reality, that description of data does not actually match our experiences. The way we experience data is often as intimately interwoven with our bodies, so much so that the line between our virtual and physical bodies actually becomes irrelevant. What we see as users or how we experience it is that all data relating to people is really embodied data or data that is used to affect our bodies and so has embodied consequences. And the instances where this is very clear is, of course, when the body is directly translated to data, or where the issue you are looking for information on is related to the body, such as in the case of sexual and reproductive rights. Immediately after Roe versus Wade, you saw that in the US, many women stopped using menstrual apps because they were so intimately aware of that connection. And the incident with Meta and Google handing over the data that you mentioned in the beginning of the session actually took place before Roe versus Wade was even struck down. So this is a long-standing concern. There's a similar example from India where it's not required by law for institutions to see Aadhaar or India's digital ID when somebody is asking for an abortion. But increasingly, we see that institutions are doing that, and also that Aadhaar is being linked to digital health records. Now, since Aadhaar data is often leaked and health records are often accessed by others, including in the family in India, this has led to a concern among many activists that the number of women seeking an unsafe abortion will actually go up in a country where the taboo around abortions is already high. So what these examples show is really that there is this very clear link between our bodies and our data that we experience in practice. And that after years of civil rights movement struggles around the world to give marginal people, vulnerable groups, greater control over their bodies, their lives, their environment, we are losing control once again. In this entire battle that Nerima and Pascal already described, the digital is really becoming a new frontier. And currently, my argument is that we don't have the language even to question it because we continue to talk about data as a resource. That prevents us from recognizing what scholar Irma van der Ploeg has pointed out, that our bodies are really currently going through a paradigm shift. So the datafied body is fundamentally different from how the body existed before. It's not the first time that happened in history. Van der Ploeg refers to the late Middle Ages, when scientists started to cut open people's bodies, and that led to a shift of how we saw not only our bodies and our health, but really the world. Today, she is arguing something similar is happening to our bodies. They no longer end where our skin touches the air. Actually, Donna Haraway already made that point in the 80s. But we have much more porous, datafied boundaries now. And so if we want to continue to protect our human rights as we understand them, we need to put bodies really back into the data governance debate. There is, to end on a positive note, I think slowly some recognition of this in the legal system already, especially where bodily integrity relating to sexual offenses is concerned. When you speak to the victims of the non-consensual sharing of sexual images, they do not talk about the harm they experience in terms of a data protection violation or even a privacy violation. They talk about the harm as one that's very similar to sexual assault, as a violation of their bodily integrity. And so in a case in a trial court in Medinipur district in West Bengal in India in 2018, we saw that a judge in the case of this non-consensual sharing of sexual images actually took a very strong stance pro the side of the woman in that case and linked when her images were posted by a man on a porn site, he actually referred to it as virtual rape. Virtual rape does not have any legal standing under Indian law. In India, as in most other countries, rape requires physical contact between two people to be a legal concept. But I still think this was a very important moment, because what the judge did was recognize that there is a fundamental harm happening there that the law is currently not recognizing, that we are often not able to talk about, but that really requires recognition. And so by having an embodied approach to data governance, we can really see that not only privacy violations, but the full range of harms that comes from data uses, that full range of harms actually comes into the pictures, as well as alternative ways of living in the datafied society. Thank you.
Thank you. Thank you so much, Anya, for those extraordinary remarks and actually challenging us to think both in terms of the frameworks that we are using, the efficacy or the utility of them to address the kind of challenges that we are addressed with. But what you very articulately brought us to is in terms of the issue of bodily autonomy in this datafied world and bringing bodies back into the conversation about the frameworks, about the challenges that we are looking at. And I hope as we go into the panel discussion in a moment's time, we are able to build on to some of those examples that you gave in terms of what does it actually mean when your day-to-day activities, your basic access to services is being mined from a profiteering perspective by companies that are using it as part of their business model. With that, may I turn to you now, Ms. Esther Kismodi, the Chief Executive of Sexual and Reproductive Health Matters. Esther, we have been discussing the relationship between sexual and reproductive health and rights, women's bodily autonomy, and privacy and data protection. As the Chief Executive of SRHM and a human rights lawyer who advised the World Health Organization in the past, how do you think this conversation intersects with considerations of equity and non-discrimination? And importantly, what are the implications for structurally excluded population and communities, including those living with disabilities or HIV and LGBTI populations and individuals? Over to you, Esther.
Thank you so much, Rajat, and thank you so much, Sagri, for the invitation. And I'm so pleased on behalf of SRHM to being a co-organizer of this event and also an organizer of a special issue of SRHM on digital technology that hopefully takes forward this issue in more in-depth investigations such as happening in this webinar. The failure to investigate and address the complexity of digital gender divide that is closely connected to intersectional forms of discrimination and human rights accountability, also including in relation to bodily integrity, as Anya pointed out so eloquently, is actually closely connected to the statement of the High Commissioner of Human Rights, Volker Türk, that he disclosed or put forward today. And let me quote him, that we are seeing efforts to push back women's rights in every region, underpinned by authoritarian or patriarchal narratives that normalize misogyny and affirm that women and girls must be essentially restricted to caregiving, reproduction, and the family, regardless of their own desires. How women and girls are being subjected to traditional roles and to various restrictions in relation to their choice and freedom, as it is pointed out by the High Commissioner, also manifest in whether and how they can have access to digital technology and how their data is handled, used, and misused. That in return, as Anya pointed out, affects the restriction on choice and bodily autonomy and autonomy in general in relation to abortion, fertility, sexual pleasure, sexual and gender expression. So let me just illustrate this digital gender divide through a couple of examples. Data, for example, from Uganda shows that men participated twice as often as women in an SMS text message-based campaign on HIV prevention. In the Democratic Republic of Congo, over 80% of callers of family planning hotline were male, based on the 2012 data. In Ghana, 2.5 million fewer women, that is about 10% of the whole population, have online access to information than men, in a world when sexual and reproductive health interventions are increasingly targeted through the use of the digital. How do we, and let's stay for a moment with Ghana, how do we understand this data in the context of multiple forms of discrimination, especially related to gender inequality? Taking into consideration, we need to investigate that these 2.5 million fewer women users are those who are living in the context when in Ghana, 2 in 10 girls married as children, and the majority of adolescents and young girls live either under parental or husband control, which not only lead to the failure of digital programs aiming to address women and girls, but also the misuse of data that linked back to guardianship law can further deepen gender inequalities. So just a little bit moving towards to solutions. non-discrimination law and data protection laws can be one of the main legal instruments that could facilitate the protection of right to non-discrimination, bodily integrity and choice in the context of discriminatory collection and misuse of data. And not only the collection and misuse of data, but the design of programs, whether they are related to sexual and reproductive health, technology, design and use, or broader technology design and use. This applies both to direct discrimination, when actually the design and use of data directly discriminatory, not taking into consideration those who are disabled, who cannot read and write, those who are illegal immigrants or migrants who don't speak the dominant language, how digital technology is communicated, or where there is no internet, for example, in rural areas. And it also, this collection and use of data also has to take into consideration and address the forms of indirect discrimination when the practice seems neutral at first glance, but ends up discrimination against people of certain ethnic groups. For example, as Narima pointed out, in case of misuse of applications, menstrual or fertility applications, for misusing abortion-related seek of information in criminalized settings. So these are the discrimination laws that can create a platform for protection. The data protection laws can particularly grant rights to people whose data are being used and imposes obligations for institutions, organizations, industries that use personal data. Let me please use the example to illustrate the intersection of human rights violation, discrimination in the context of sex tech that we very often don't talk about in the context of sexual and reproductive health and technology. While not every sex tech device collects user data, those that do may collect significant amounts of personal information, where, for example, smart vibrators or other sex devices or sex toys are often used by sex workers in the context of sexual entertainment. They offer new opportunities for people who are not necessarily engaging in the sex industry. Multiple security vulnerabilities have been identified in relation to the use of sex technology and user data leaked to the advertisers and authorities. So in the case of sex workers, for example, when they use technology or, for example, advertisement or client connection website, in criminalized settings, their personal information is very often used and misused and disclosed to authorities, putting them even more vulnerable position. In addition, the development of algorithmic sexual profiles that predict user preferences and behavior may also have serious implications for discriminatory stereotyping, especially of women, and access to services, and very often leads to targeted misinformation in relation to sexuality that can have harmful effects on sexual health and sexual behavior, both for adolescents, young people, and adults, especially vulnerable populations. Effective non-discriminatory data protection laws and discriminatory laws, for example, in this context, could be applied in such way so that data which relates to a person's sex life or sexual orientation, for example, shall be considered personal, sensitive personal data that can be applied in relation to abortion-related or fertility-related or related applications, which means that processing such data must be done anonymously or as after securing explicit consent. To ensure that standard of explicit consent is met, companies selling sex tag, but for example, menstruation apps or other apps as well, need to be clear about what data they will be processing and for what purpose, instead of pushing responsibility onto users who might not speak the language, who might not be aware of laws, who might be subjected to criminal laws, or who might not be able to interpret pages of legal terms of conditions, messages. So instead of that, explicit consent need to met in order to disclose information. So in this context, for example, and using sexuality and sexual health as an example, safe sex that we so often connect to condom use, for example, in the context of HIV, within this framework becomes, safe sex becomes a question of keeping one's data safe, and it becomes clear that sex tech is a contested side of data justice and the matter of non-discrimination and data protection. So I will go ahead and talk more about accountability, but I just wanted to illustrate a little bit the intersection of non-discrimination, data protection, and possible solutions, and what we can move forward to.
Yeah, thank you so much, Esther. That's extremely helpful. And also, something that we often ignore because we are so used to looking at how the social media platforms and the information that is available on that and reacting to the content that is presented to us, that we do not look at both the issues in terms of the design part of it and how the technology is being designed, the implications of not having women and girls part of the design of the technology and how artificial intelligence and algorithmic models are being developed, but also at the other end of the spectrum in terms of the tech companies, how these decisions are made and with whose participation. In most cases, what we do know, these are decisions made by men for women on how these apps are being developed and how these issues are being addressed. Colleagues, this brings me to the panel discussion. If I could have all the panel members to please switch on their cameras. What I will do is I'll just ask a question to each of you sequentially. Please try and keep your responses short, if possible. These are very wide-ranging conversations, I recognize, and which will also give us a few minutes towards the end to take audience questions as well. There are a couple of questions already from the Q&A section that everybody can have a look at it. If I may come to you, Pascal, and you've heard the conversation, the kind of issues, the challenges that have been highlighted, and given that the necessary safeguards are often not in place, especially in low and middle income countries, the unbridled technology revolution can turn the transformational promise of digital health into a fallacy for those who need it the most. Somebody recently gave me the statistics is that much of the money that is going into for a security purposes for tech-related interventions, most of it is in the United States itself, not in low and middle income countries, where the risks because of lack of regulations are one of the highest. So this is particularly true when discrimination is perpetuated at the institutional and systems level, with digital health programs designed failing to address the kind of issues and the intersections that we are talking about. According to WHO, AI, if ethically designed, holds great promise for improving the delivery of health and medicine worldwide. But as we have heard from different people, could you share your thoughts on what changes could be made to digital health program designs to create more equitable, gender-intentional solutions? In other words, how could digital design be more addressing to the women's rights that we have heard about?
Thank you, Rajat. I mean, I think in some ways it's a real shame that the abuse of power issues that I'd raised before, even in the digital ecosystem, provides the bar, which is a very low bar, for the assessment of the potential of technology as a tool for the delivery of health services. But hopefully we can try to stay abreast, if not ahead of the harms that that have been raised in this discussion. We know that the technology is moving very fast. And so we must do the best that we can to anticipate the ethical issues before they arise. Researchers do this all the time. Ethical issues in digital health solutions should be treated with the same commitment to the review, the oversight, the human rights dimensions commonly applied throughout all of our various areas of health. Digital health is making services and information more accessible to some and can play a role in equity of access and making information more widely available. It's a huge step forward in sexual and reproductive health. The topics that are too often excluded or not talked about can be accessed through digital technologies now. The videos, and there's so many different ways now of being able to provide this sorts of information that we never had access to before, certainly in my day. But we must be aware of the local context and that not everybody has access to the digital services. So HRP and WHO have a digital implementation investment guide that aims to help governments and technical partners plan for taking digital health forward. It walks through selecting different digital health interventions that are aligned with the needs of people and with their various contexts. And importantly, it's recommended that we always keep the end user in mind, designing for their needs as opposed to what we imagine the needs might be, and shifting towards digital solutions changes service delivery. And we have to think through what this means for those who experience the changes. At the ideation stage, new tools need to be fit for purpose. Often the digital interventions will be an enabler, but it will inevitably have some limitations that should be thought through and addressed. And also the WHO guidelines on digital interventions for health system strengthening states specifically that digital intervention should not exclude or jeopardize the provision of quality non-digital services in places where there is no access to the digital technologies, or they are not acceptable or affordable for target communities. Again, this it just really points to the fact that I think we are actually, as I say, either abreast or slightly ahead of. I know that there is a big push, but at least within the context of WHO and the health services, we are being given some space to kind of take a step back and really think about the communities that we are serving. So at the design stage, there needs to be validation studies that take into account the diversity of the populations, informing machine learning algorithms and advancing transparency of the underlying data sets, informing the predictive models on which clinical decisions are expected to be made, and so on. Now, I can give a range of examples of various studies and so on, but I'm happy to come back later to give the other panelists an opportunity to intervene as well.
Thanks so much, Pascal, and for laying it out and what you said so nicely in terms of need to think from ideation to implementation and to make sure that these issues are embedded and not done as a post-mortem analysis on how we can address the issues of ethics, etc. There is a lot of interest, as I can see from comments, in terms of the WHO's work, the digital implementation guide, etc., which are resources which we can share in the chat as we talk through. Narima, if I can come to you next, and I understand from Kaylin's 2020 report on enhancing privacy and data protection in the management of health data, that Kenya digitizes methods of data collection, analysis, and storage are evolving from analog or the paper-based systems to the use of biometrics and other biodata. And we heard from Anya, for instance, some of the challenges from the Indian experience that it can bring as well alongside. This is an evolution that is occurring despite of a few corresponding legal safeguards, and even where safeguards partially exist, there is either no or poor implementation. Could you tell us more about the kind of SRH data that is being collected in Kenya? Who is collecting it and why? And if you could also talk to us about the implications of this data being collected for the privacy and bodily autonomy of women and girls. Again, something that a participant has asked in the Q&A as well. Over to you, Narima.
Thank you for that. So just a backdrop in terms of what is happening in the country. So there has been continuous attempts to digitize our health systems. It's been fragmented and fractured thus far, with multiple policy frameworks that don't always speak to each other, and significantly with a Data Protection Act, which we're happy about, but which isn't being implemented or enforced as it should be. So in terms of the kind of data that's being collected, and we've seen this in recent studies coming from our digital health and rights platform and from other interventions that we've done within the country to understand what's coming out of data being collected. Fewer and fewer people actually use digital health apps. So they are available, quite a number are available within the country. However, not that many people use the apps and the technology. More often than not, the digital space is interacted with based on web searches, social media, and platforms. And in those spaces, we see a lot of health information being shared and then being utilized, but in a very unregulated way. So just want to do that initial distinction. And there we've seen intensely a lot of young women, girls, young men, young people sharing health information, sensitive health information, including HIV status, pregnancy status, all of this in these apps, in these spaces, and it leading to offline consequences such as violence, physical or otherwise sexual harassment, bullying, physical bullying, cyberbullying, and so on. So that is one of our significant problems. We have a backdrop of not easy access to health systems, which has led to an increase in seeking health-related information online, but not from trusted sources. So more often than not, we're looking at Google, Facebook, TikTok, Instagram as primary sources of health information, and a lot of self-diagnosis that is happening within the country because of this lack of access to healthcare information in the public health system and from trusted sources which are easily available. And then when we come to the use of mHealth and mApps, which is encouraged and required by our Health Act, the type of data being collected, sometimes by private users, by private tech companies, which there are a number of, many quite small. So there's a lot of private tech companies, many quite small within the country. And a lot of what you've seen being collected is menstrual data, so your period cycle, data around your age, obviously your weight, your health, your age, your weight, your height. So primary data, not often linked to geographical data from the private tech companies. So not often linked to geographical data, however, from the government. The type of data collected by the state is linked to your geographical data. So we have biometrics linked to geographic data, linked with other primary data. So your name, your ID number linked with your either biometrics through your eyes, your fingerprints linked with where you live. And this has been the biggest challenge when it comes to properly rolling out digital health apps, because this remains challenged within our court. So a significant part of this was the Huduma number process, which happened in Kenya, where the aim was to get everybody to have one single number that gives you access to government services. Now, the single number was supposed to link biometrics with biographical with geographical. This was challenged in court twice. The first time successfully because of possible breaches of privacy, function creep. There was fears around the violation of ethnic minorities, so the exclusion of ethnic minorities. And then the second time also challenged, but the only ground that was successful was on privacy. So what the government then needed to do is put in place a Data Protection Act, which they have, and implement and enforce it, which they are not yet doing. So at this stage, there isn't a systematic way in which health data has been collected by the state through technology, but there is an opportunity for them to do it, and that continues to happen. So the Huduma number scheme is still ongoing. I think it came out very strongly during the COVID-19 pandemic, where many were threatened that they wouldn't be able to access government services without a Huduma number, while at the time, there was still a court order saying we did not have to get a Huduma number until the safeguards were put in place. So it continues to be a drive by the ministry to get Huduma numbers, despite there not being significant safeguards, to ensure that such data will be protected, there will be no function creep, and there will be significant safeguards to the health, lives, and well-being of the people who share this data.
Yes, that's very helpful, Narima, and thank you both in terms of what is happening, but what might be some of the solutions that are available. And there is learning that is starting to emerge from other countries and other settings as well. But also, and as one of the question points out, it also points towards the absence and the paucity of hard data that is needed and that should be researched upon, and the need to develop a longer research agenda, which is something I think we need to reflect on as well. Esther, if I could come to you next, and with reference particularly to the recent SRHM report applying a human rights-based approach to the process of knowledge creation can be done with regards to what the research is being done on, how it is done, and how the knowledge is created. Could you please outline to us very briefly some of the key principles that your report highlights, but also how those principles could potentially be applied to the design of digital SRH solutions? Over to you, Esther.
Thank you, and I will be briefer to make up my time. So in our recent report, we talk about basic human rights principles, such as intersectionality of human rights, non-discrimination, accountability, transparency, how it applies to research. And I think we were brainstorming that when we were preparing for this webinar, that how these principles and the principles that we use in sexual and reproductive health research, programming, service delivery, how actually it applies to data governance. And I would like to spend just a little bit of time about accountability, because we talked in some way about intersectionality of human rights, that I fear that I almost think that we need to go back to the basics, who the rights holders and the duty bearers are. And I think we need to look at it in the broader context of digital technology and in the context of specific countries and states and cultural and political settings. And we'll need to look at states and not just governments. So within the government, in relation to sexual and reproductive health, of course, we have the Ministry of Health, but the Ministry of Health needs to work together with the Ministry of Technology and others. But there is a huge emphasis on the parliaments as well, who need to develop these laws that in many, many countries, they just simply don't exist in relation to data protection, and especially have no understanding how existing laws relate to data governance. So we don't necessarily need to develop new laws, but apply healthcare laws, patients' rights protection laws, data protection laws in relation to digital technology. And I just would like to spend 1 minute on the private sector, because I think it's really, really, really important to recognize that there is in this whole digital technology and technology domain, there is the private sector that are kind of two-folded in relation to sexual and reproductive health. There is a private sector who is actively involved in the development and implementation of sexual and reproductive health programs, such as profit and non-profit oriented service providers, pharmacies, private laboratories, pharmaceutical companies, manufacturers and distributors of SRHI products, and as well as national, regional, and international funders who are pushing for the use of digital technology for increased access to sexual and reproductive health services without thinking through about marginalization, structural exclusion, gender equality. And there is the other private sector who has nothing to do with sexual and reproductive health and provision of sexual and reproductive health services or sexuality, who are involved in technology, in the development of technology, and completely blind to sexual and reproductive health sensibilities. So this whole accountability has to be examined around who the actors are for accountability. And just a very short example, when we do research, we need to follow certain guidelines for data development and protection and data use and knowledge creation. We have to go to ethical committees in order to do so. In use of data, there is no governance around that. And just let me use the example of the European Union and the Council of Europe, in which context the data protection, the European Union General Data Protection Regulations and the European Data Protection Convention, that is applicable to Europe. And of course, this convention needs to be looked at in the regional, national, subnational context. But this introduces the concept and the institution of data protection impact assessment. And the beauty about this, that like an ethics committee in relation to research and knowledge creation before applying an intervention, asking to systematically analyze, identify, and minimize the data protection risks of a project or a plan or a programmatic intervention. So this data protection impact assessment could be very important tools in relation to data protection governance, to many, many sensitive issues that are surrounding sexual and reproductive health and rights. Thank you.
Thank you. No, thank you so much, Esther. And as you very astutely put, I think as we go from analog to digital, we probably need to go back to basics on the principles and understand how we apply the issues in terms of human rights standards to the digital space, which continues to operate as an accountability-free zone in many ways as well. But also it is throwing a set of contradictions which we don't quite know how to address. Because at one end, if you actually see these apps, these menstrual regulation apps and these technological solutions are being provided as part of our empowerment framework. So one would need to also understand how do the users are using it and how do they perceive, considering also how the data that they are putting in is being used as well. Anya, which brings me to you for the last set of structured questions, and then there are a couple of questions from our participants, which I will read out to each of you. But Anya, if you could talk to us about in situations even where it exists and is being implemented and enforced, privacy and data protection legislation fails to address the vast power asymmetries between data processors by the government or the big tech companies with global monopolies and individual data subjects, which seems highly inadequate. And the context in which you are based is a very good example of such a situation happening. So how do you think data governance could be reimagined with women's rights at the center? It seems like a sort of a cliche that I'm talking about, but would love to hear your views on it.
Thanks, Rajat. And I fully agree with Esther that we need to go back to the basics. And therefore, based on what I said earlier, my solution is, of course, to put bodies back into the data governance debate. And I think it's really important because at the moment, I don't think we have enough normative arguments to ask for what we should be asking if we want to continue to make human rights real. I wanted to come back to the point of Kenya seems to be lacking a lot of safeguards. India definitely does. And sometimes, you can think of many reasons why that may be happening. But for me, that's one logical consequence, definitely in the case of India. It's a logical conclusion of talking about data as a resource. The Indian government, in fact, in some of its policy documents, talks about data as a national asset. If you see it as a national asset, and India actually is in a position to compete with China and the US in a way that possibly no other country in the world is. If you talk about data as a resource, then you would say the government has a responsibility to make the most of it. right? And then that balance with some of these other protections becomes a different question than it does in some other countries. I feel, for me, this is really the logical conclusion of that debate. Of course, this completely changes when you put bodies back into the data governance debate, and that's why I think it's so important. I loved some of Esther's examples and also her point about how sexual orientation really should be considered sensitive data. But again, to make the point about how current frameworks are so limited, Facebook is very likely to know your sexual orientation, even if you've never filled the box on what your sexual orientation is. How do you protect that information then? Because they're just deducting that from all that you're doing. You've never given it to them. Should they not be asking the question in the first place? At the moment, we have no consent about how that should be happening as societies, right? And again, those are questions that are hard to even put on the table. I often get reminded of a paper two Yale researchers wrote a few years ago, where they basically wrote an algorithm that turned out to be better at recognizing people's sexual orientation based on their facial features than people would be. I thought, how is it possible that this was possible in one of the top universities in the world? This is a terrible question to ask that puts so many people's lives at risk. But again, it makes sense when you look at data as a resource, because it doesn't have to go to an ethics board either. Then no, there were no real people involved in this research. If it would have had to go to an ethics board, and if you would see the links with actually lived people, then obviously this could never have gone anywhere. The data about, it's hard to say Facebook can't collect any of the data on the basis of which they can have information about your sexual orientation. And that's why I think we can't, like, stopping the collection of data will be really, really difficult. So we need to start thinking about other ways, about even like, what are some of the questions we can or can't ask? I also wanted to give a very concrete example about what using this body as data framework can do by talking a little bit about the reimagination of consent based on a paper I wrote together with a former colleague, and I think the link was already put in the chat. So starting from this body as data perspective, we asked the question, if we look at how feminists have discussed consent in the context of sexual relationships, what would we need to do with consent and data governance to actually achieve similar protections and similar standards? Consent, of course, online is really a joke, right? I can't think of any other fundamental right that we can just sign away by ticking a box. Even the right to life has a protected component. You can't sell yourself into bonded labor, for example, in any country in the world that I know of. And yet somehow online, none of this applies anymore. So I won't go into detail of our analysis of all the problems with the current consent framework. It's in the paper, but we basically came up with 6 principles, and 2 of those I think are the most important. One is consent must be embedded in a notion of relational rather than individual autonomy. And the second is conditions must be created so that consent can be given freely, free of any oppression or fear of violence. And so why are these 2 principles that very much come out of feminist theory so important? Because they put the question of power relationships and that inequality between us and all these data collectors so clearly back on the table, right? That taking away your rights by ticking that box online becomes completely unimaginable if you put bodies back into the debate. There are a number of other harms that our analysis made clear that this makes possible, right? By allowing this ticking of the box to happen in current circumstances, we're really individualizing the burden of consent in completely unequal circumstances. So that now when something goes wrong, it's on you as the user, right? Because you've consented after all. And the question about unequal power relationships, we can't really put on the table anymore because you have already consented. What feminist principles do is provide a language to start questioning that and to start talking about the balance of power, how clearly skewed it is, and how by definition, that skewed balance of power makes meaningful consent online at the moment impossible. How to change that also then has a whole bunch of things that are needed. Definitely legislation, but again, if you think of that unbalanced power structure, that's clearly also a matter of design, of architecture, of the ecosystem, of what practices we are going to allow in the first place or not. And I come back to the paper on sexual orientation, which I think should never have been written. Concretely, just to give one concrete example that we also gave as a recommendation as the outcome from our paper, in many cases at the moment, there is widespread third-party data sharing. Interestingly, even some of the websites in the US that are selling abortion pills are doing this, one of which ironically is called abortion privacy. If as a user, you have to agree to third-party data sharing, even if it's not essential to the service that you are getting, then by definition, that's not meaningful consent anymore, even more so because often the third parties can then also share with third parties, etc. And you would have to go and read all of those consent notices. This is still in many countries, perhaps not in Europe, but outside of the EU, in many countries, a widely accepted practice. If you look at consent from a feminist perspective, then by definition, this should be banned. It should not be possible anymore. Mm-hmm. I do want to emphasize, though, that adopting that perspective is not necessarily only about banning or forbidding things. I think when we start to think about our bodies as really datafied and from a different perspective, we can also start thinking much more creatively of what are then other ways in which we can imagine new apps, new services, and new ways of doing this. And I think that's also really something much more of our attention should start going to. Thank you.
Thank you so much, Anya. That's extremely helpful, and just the redefinition of consent and how we understand consent as a legal term is very, very helpfully put by you. But I think one of the things that you are challenging us is to understand and reimagine how we look at data and whether data needs to be rethought as a global public good, which by then definition taken out of the market dynamics, that it is not a commodity that we are trading in, but a global public good that we are investing in and providing safeguards. It's a complete shift of strategy and approach to what is happening at the moment and how some of the technology leaders are looking at it and how it is being mined. This brings us to the end of our conversation. There are a couple of questions on the chat, which I would like to take, and maybe I can just pose them to the group and each of you can take whichever one you feel like. The first, which I think we haven't quite touched upon, is how should we evaluate the COVID-19 experience, which drove the push towards telehealthcare globally, and are there attempts to correct step in the right direction? And if so, if there is a cautionary story hidden somewhere on how we were using technology to find solutions over there. I do think we have looked about the issue of regulation. One of the questions that were put is, one thing, however, to flag is that much of the marketing of menstrual apps and these other apps are actually being promoted and perceived by many women as by gaining bodily autonomy, control over their periods. For example, it points to the need for a research agenda on how really unpacking of what is understood, perceived, and concerns of bodily autonomy. I think this might be a recommendation to us to do more work. And then just finally to take this point also in terms of the use of open source solutions, how can they be considered for secondary use as data as such? Open Safely, for instance, is an example that a colleague has given as a secure, transparent, open source software platform for analysis of electronic health records, etc. Very briefly, 1 minute and no more, any reactions at this stage? Unfortunately, we are running out of time and we will have to wrap up very soon. So before I hand it over to you, Sagri, quick reaction from any of the panelists. Anya, do you want to start by adding anything and I can just go through the others?
Maybe very briefly to Avni's point about shouldn't we ask people? I do think that's important, but I also think that's not what we should fully rely on right now, as long as we don't also do much more awareness raising about what's actually going on. If people don't understand the ecosystem, they're also not in a position to really understand what's happening, right? And I'm also a bit wary that a lot of people accept what's happening because it's happening. That's precisely something we need to step away from. I know that in many countries, I know in India for sure, the National Family Health Service always shows a really great acceptance for domestic violence. And still, we're not going to say domestic violence is okay, right? I think we need to move towards something like that with this also, but asking user input together with greater awareness definitely would also be very valuable. You see that people's opinions have started to shift quite a lot about this also because they became aware more and more, no? At some point, Mark Zuckerberg said privacy is dead. He could never start a conference with that in big letters behind him anymore.
Yeah, absolutely. Thank you so much, Anya. Narima, anything you want to add?
On two things. One, yes, I do think that telemedicine, e-health is a step in the right direction, especially pushed by the pandemic. We saw a lot of the good that came out of it. I think it just goes back to what Esther was speaking about, is the need to ground this on a rights-based or a human rights framework. And that's been the gap. So I've seen how important it is to breach access, to breach availability, to breach aspects of healthcare, but then it has to be grounded on a human rights framework. If you don't do that, then we'll just reiterate the same problems that we already have. On the second thing, in terms of apps being used to promote women's empowerment. So I think with menstrual apps and such apps, yes, really good having that level of information, especially when there's digital literacy and awareness. But the key thing is there has to be digital literacy and awareness of what these apps do, what they take from you, and how they track it, like what type of information they use. So we've seen some of challenges coming out of this is in Nigeria, for instance, menstrual health apps have been used to track women's cycle and use targeted ads around contraceptives, not towards contraceptives, modern contraceptives, but towards traditional methods of contraceptives. So especially if women are being seen to use these apps, as well as their location being pinned to healthcare services where they're accessing contraceptives, there'll be targeted ads pushing them towards traditional contraceptives, which would then mean it's less likely to be effective and less likely to push them towards unintended pregnancies.
Thank you so much, Narima. And I'm going to quickly go to Pascal first and then to you, Esther, before handing it over to Sagri for the concluding remarks. Pascal, over to you, please. Pascal, you're on mute. All right, I know she's having some data issues. So maybe, Esther, I can come to you next, and then hopefully by then Pascal's connection would have resolved. Over to you, Esther.
Yeah, I just would like to go back, and it's also a kind of summary about possible way forwards to the question of Michael Akanji about sexual orientation. And I just thought that while setting the principle and institutions and processes is very important, I think it's also very important to act in terms of very specific actions. And these could be, for example, as we discussed, for example, in relation to criminalized populations and those expressing their sexual orientation in various ways, to process data anonymously. There are good processes that are setting the procedure of de-identification of data after the data is being used, explicit consent for disclosure for sensitive personal data that should be implemented for marginalized, vulnerable, structurally excluded, criminalized populations. In terms of EI, prevent algorithmic sexual profiling, but also algorithms can also provide an opportunity to set them up in a way way that they are promoting positive sexual and sexuality related rights and images and profiles, and setting up procedural safeguards, as we mentioned before.
Thank you so much, Esther. I know there seems to be a connection issue with Pascal, and she's just messaged me to saying she's not able to speak, but the point that she wanted to emphasize that we cannot just catch up with technology. We have to be proactive. We have to take proactive measures in terms of addressing the kind of challenges that the technology is presenting to the way we look at issues around bodily autonomy and gender equality as such. With that, Sagri, I'm handing it over to you for the concludatory remarks, but also to thank our participants and panelists. Over to you.
Great, thank you, Rajat, and a big thank you to all who have joined us here today and the panelists for this critical discussion, and a very happy International Women's Day. What a great way to celebrate this day. We heard a range of perspectives on data governance issues from the speakers, both from the UN, but also civil society organizations, and these diverse issues really converge around what it means in terms of data governance. So I'd like to take this moment to just summarize some reflections. I will not try to be comprehensive, but just illustrative of the key points that emerged that we need to take forward, that the panelists were pretty clear on. So one is the undeniable power asymmetries between global and national data controllers and processors, and the individual data subjects, all of us, wherever we sit. And we did see that as the datafication of our lives intensifies and sensitive personal data about our bodies is being bought and sold without meaningful consent, as many have spoken about, which includes the ability to restrict, negotiate, withdraw consent, and without the power and agencies to say no. This is really something we need to take seriously. We must, as Anya said, put the body back in the data governance debate and challenge and reimagine the frameworks that are currently available, which really limits our ability to make the kind of transformative change we are looking for as a group. And throughout the discussion, we heard about the many examples of how digital information has been used and continues to be used to violate the rights of women and girls across the world in as diverse as contexts of the USA, India, and Kenya. And just to recognize that a lot of the tools that are being used are very similar across these countries if you look at the conversations around India's Aadhaar and Kenya's own approach. A second point is really around the transformative impact that technology could potentially make in the daily lives of women and girls, but the need to really put women and girls in the driver's seat, not just as consumers, but as conceptualizers, designers, and solution makers. And the global community needs to act collectively to ensure that this happens so that women and girls continue to retain control over their bodies. And finally, I think the main point was a way forward. And we heard a number of ways forward, and thanks, Esther, for that last point as well. But really, the way forward looks to be promoting the widest possible public and multi-stakeholder debate on the development and use of big data technology and how body data protection regulations need to be considered, highlighting, as people pointed out, the skewed balance of power, how we view ourselves, data, the various threats that are posed, because as many mentioned, this is not well known, and how our information is being mined to develop entire data and identities that pose a threat to our lives going forward. So we do need to create a space as we bring this forth in the conversations that are happening today and as they continue to happen going forward. So I would like to just end by saying that this is really an amazing conversation that we've had, a start, I'm sure, to many. And I know today we are ending here in Malaysia, but the US is just starting, and there are multiple conversations I'm sure that are already taking place. So thank you all for this opportunity. And before I end, I wanted to recognize and thank our team who has been integral to the success of this webinar. Vidisha, Sarah Chamberlain, Vidya, Sylvia, if I can ask you to just switch on your camera so that we can all thank you. And a big thanks to the panelists and the attendees. Thank you.